Hi, class. All right, we made it to week 2. So I'm just going to share a little bit about the assignments that are due this week and cover some next week. But before I do that, I kind of want to zoom out to give you a bigger picture of this program and of this class. The goal of this class is not mastery or memorization. The goal is just to expose you to some of the theoretical concepts that are going to be key and foundational in your line of work as a therapist. It would be unrealistic for you to assume you have to have all this down by the end of the class. Getting a master's degree is hard. If it was easy, everybody could do it. But you can do hard things. And kind of to give you a picture of how, I'm sure you know, but most master's degree courses are over a 15-week span. And it's very common for a grad student to take 2 or 3 classes at a time. So you will have traditionally a discussion board post due, a quiz due, an assignment due within the same week, but for multiple courses. The way this program is set up is they're taking a 15-week course and they're condensing it to 8 weeks. So all of the material is there. They're just shortening out of the time that they're presenting it to you. And you're just concentrating on one class. So it is going to feel like you are drinking from a fire hose, but this is master's level work. And I have full confidence that all you guys can do this. Just take it one day at a time. If you're feeling overwhelmed, just a tip that I've learned, even in my doctorate program, is just one day at a time. What can I do today to get through today? And if you take it one day at a time, with a lot of prayer and coping skills, then you will get through it. So going back to why these courses are so fundamental for your line of work as a therapist is when you get to practicum, you are going to actually practice these skills with real people. You cannot legally provide psychotherapy in our state without being licensed, unless you're under the care of a supervisor who oversees all of your cases. So we're just trying to get you to a place where you can show some level of competency so that the supervisor can hire you and bring you on to their clinic or to their practice, and then you could see their clients, their patients under their license. And so it is important for you just to have an idea of some of the basic and even advanced clinical skills, but don't feel like you have to have this all memorized and you have to have every single theory mastered. So hopefully that will bring some reassurance to you. It is going to be okay. You will get through this. As I mentioned earlier, please reach out if you have any questions. But let's go ahead and zoom in and then let's talk about this week and then what to expect next week. So here I have the course. I'm not sure if your screen looks different than mine because I'm under the administration page, but looking at week 2, what you're going to do is go down to week 2 course assignments and materials, and then you are going to read Gay Hart's Person-Centered chapter and watch her lecture on person-centered. I actually did a whole recording on person-centered, but then I watched hers and I was like, she did a phenomenal job. So I'm giving you guys the gold standard. So watch hers. And if you want to, you can see a mock session of a therapist actually practicing these person-centered interventions. So after you do that, then you're going to engage in the discussion board post and then take the quiz. The way Moodle designed the quiz, it kind of shuffled the questions, but they're all going to be from the reading, pages 129 and 187, and it's an open book quiz. Then I'm going to jump to week 3. Let's go to week 3. And here's when you're going to actually apply the material that you read. In Gay Hart's book, under Person-Centered, she has these things called, I think, Try It Out, where she lays out specific interventions that a therapist can practice using the person-centered theory. So I want you to take note of that, so that way when it comes to your mock therapy sessions, you can use that as a guide. I recommend, honestly, guys, like taking a sticky note, taking a piece of paper, and just jotting down some of the interventions, phrases to say from a person-centered. Don't overthink it. This is just a chance for you to practice the intervention, not to master it. Also, when you're watching the lecture and you're looking at the mock sessions, take note of the specific interventions that the therapist uses from this particular model. So with the reflection paper, this is not a huge assignment. I'm not looking for anything formal. I just kind of want to see what you think about this theory. This is a chance for you to just digest it, look at the strengths, the limitations. Do you think it's going to fit with your personality? The directions are in the syllabus, so follow that, and then the rubrics. But then talk about just, this is my thoughts about the theory. That's it, kind of simple, nothing formal. Where I really want you to spend your time, though, is in the case vignette. So looking at Helen, following the rubrics, you are going to conceptualize Helen through the person-centered theory. What I mean by is pay attention to how a person-centered theorist identifies pathology. How would they describe why a person is having problems or is in distress? So when you read Helen and you see that she's struggling, you'll be able to say, oh, a person-centered does this because of this. It's because she is not, I'll just give you an example. She's not living a congruent lifestyle. Congruence is very big for the person-centered. And so as you're reading Helen, you'll say, oh, because she's not living a congruent lifestyle. And that's the reason why she's having some distress. And there's other things too from the person-centered theory that will describe why a person is having some dysfunctional behaviors. Then you're going to look at what are some, interventions a person-centered therapist would do. What are some treatment goals? All that is laid out for you in the textbook and in the lecture that Gayheart provides. Then what's due is the role play. So this is when you're going to pair up with 2 people, so 3 people total, a triad. And then you're going to just practice using the therapeutic interventions. The evaluation worksheet is done by the observer. So you have the therapist, you have the client, and you have the observer. Go ahead and take either via Zoom or Google Meets or whatever you prefer, but go ahead and take a recording, about 20 minutes of the mock session, and you're going to upload it into Moodle, as well as the role play evaluation. And so this is where I recommend taking notes as you're studying the different theories. Take a mental note of the interventions that are being used. So when it comes time to role play, you have those down. I'm not looking for mastery. I'm not looking for perfection. It's just a place for you to practice these skills. So here is an overview of week 2 and of week 3 using person-centered theory. If you guys have any questions, please reach out. I'm rooting for you. All right. Have a good week.